Hello, and welcome to RTV Chit-Chat, brought to you by Raising the Village. Raising the Village, or RTV, is a nonprofit organization that partners with last mile communities in rural Uganda to end ultra poverty in our generation. I'm your host, Ahad Alankar, and I'm part of RTV's small but mighty communications team. Let's get started. In this episode, we will discuss how Raising the Village is addressing ultra poverty in Uganda during the harsh effect of COVID 19, where last mile communities require even more assistance so that they can emerge from uncertainty. Hi, everyone, and welcome to episode 7 of RTV Chit-Chat. Our guest today is David Kafambe, the head of programs at RTV. David demonstrates a lot of passion when working with last mile communities. He understands how to connect with their innate creativity to get them out of ultra poverty. As an expert in many projects such as youth, livelihood, family support, schools, and healthcare, David will talk to us about the health situation in Uganda and how our programs respond to public health and the economic crisis brought by the pandemic. Hi, David. I'm thrilled to be here today, and thank you for being part of this episode of RTV Chit Chat. I'm looking forward. It's such a needed topic, not just for me, but for our listeners. So let's get started with what's happening today, the global pandemic. Since March 2020, there is no doubt that COVID 19 has deepened global inequities, with ultra poor bearing the impact of a national lockdown for almost 2 years now. Can you tell us how the pandemic has affected Uganda?
Yeah, thank you for that question. It is true that the pandemic has really had an effect on Uganda, but just to give you a brief background of how we got where we are right now. I remember way back in 2019, towards the end of the year, 2019, we heard that COVID was affecting people in China. Little did we know in Uganda that it would also reach us. Then I also remember that a few months later, beginning of 2020, then it became very serious in Uganda and we experienced the first lockdown. In fact, that lockdown happened towards the end of March. And when we had never known about a lockdown, so we didn't know what to expect. So people just went into their homes and they were curfew and all these kind of things that were new to us. But within just 1 week of that lockdown, we started seeing that so many people had depleted their savings. Most families in Uganda could not even afford 2 meals a day. And I remember at that time, government had to start providing and deliver food to the affected people. So communities were starving and they didn't have food within just 1 week of the pandemic. And that went on for quite a bit of time. This was just the beginning of a bigger problem. So when I go back to your question and I start looking at the 2 years of COVID-19, the impact is even much greater when it comes to the ultra poor, because people in towns were able to deplete their savings, but when it went to the communities where we are serving as Raising the Village, the ultra poor, it became even much bigger. That crisis has affected their economic activity. And now we see more people living below the poverty line. During these lockdowns, we are seeing market disruptions, which are actually forcing farmers to sell their produce at very low prices. We've also seen COVID-19 cases increase, and the treatment is quite expensive for the ultra poor. Most of the ultra poor people have ended up selling their assets to take care of their medical deals. I would say the pandemic has really impacted us. And reflecting on the 2 years, this has not been something that we had expected.
Wow. I'm sure this is really difficult. So, as the head of programs at Raising the Village, David, can you tell us how the programs are operating during the pandemic in Uganda? I'm sure what you just explained makes it more challenging. So, particularly in last mile communities with a significantly weaker healthcare system, how are you operating? What are you doing?
Yeah, like your question it is actually true that the health system in Uganda has always been having challenges, and the COVID-19 pandemic made even these challenges bigger. When we reflect on our health system, we know that for very many years it has been underfunded, and there are so many people who need healthcare. So there is underfunding, but then we have so many people needing healthcare. Now, for us as Raising the Village, we are working in last mile communities. So when you look at the statistics, actually in the last mile communities, they are alarming. We see the doctor to patient ratio, one doctor for approximately 20,000 people. That's a huge number.
Wow.
And you know that the doctor cannot actually reach out to all these people. If we even look at the ministry itself, the Ugandan Ministry of Health, and they conduct annual surveys that assess the health system performance, you are going to see quite a number of challenges. We've seen that their surveys have shown significant shortage in availability and quality of service. We've seen that the people who seek services in our health centers, especially the government ones, are complaining about poor sanitation. The issue of lack of drugs and equipment has always been there. The COVID actually even made it worse. People are always staying because there are so many people are seeking health care, so they are always staying and waiting for long times. So there are quite a number of inadequate referrals, and I can go on and on. So when we look at now the last mile communities, even this weak healthcare makes it even tougher in these COVID times. First, they are hard to access because of the poor road network. The last mile communities are quite far. Then the poor infrastructure even makes the transport very, very expensive. Then most of these communities live on less than $1 per day, and therefore cannot access healthcare services from private health centers. So remember, there are also regular drug stockouts in the government-aided hospitals. So as a result, we are seeing that some of our last mile communities are not able to access services, and we've seen many of them die. And that is why Raising the Village is one of the few organizations that have come. They've remained operational through the lockdowns, because the services that we are offering these communities are essential services. We were privileged that the government was able to recognize us and give us the permit to operate even through the lockdown. And we've tried to offer essential service to these underserved communities. And with our government partnerships, we've seen some kind of support going to these last mile communities.
Right. Speaking of services, I would like you, David, to take us through some of the RTV health projects that have immediate implications on our partner communities' lives and livelihoods.
Yeah, like I've mentioned, is that some of the service, whatever we are doing as RTV, has impact on people's health. So all the challenges that I've just mentioned, they are all impacting people's health. If we are talking about poor economics, we are talking about gender disparity, all of these have impact on their health. So as Raising the Village, we always say our work begins where the road ends. So last mile communities, because of their poor infrastructure, we've come out very strongly to see how we can support them and make these communities find sustainable solutions. So now, speaking of sustainability, so we believe that for communities to become sustainable and self-driven, they must be empowered to make their own decisions, regardless of their age, gender. So what we normally do is, one of the first interventions that we've done for these communities is to conduct household training to support them in this decision making. These trainings are conducted several times around different topics. We are talking about financial literacy, we are talking about mindset change, we are talking about village savings and loan associations, and we're also talking about gender equality and responsibility. So all these, so the idea of communities first, supporting their mindset and being able to find solutions becomes key. Then from there, because that's now about building their capacity and mindset change, then the next intervention that we focus on is now offering them services. So we conduct health outreaches. And like I mentioned before, that Uganda's healthcare has a challenge of inadequate health workers. So for us, as Raising the Village, as a way of mitigating this, we bring these services closer to these last mile communities through health outreaches. So we are able to mobilize health workers from through the partnership with the government, health workers, and then, and then we are able to support with, medical supplies and take them to communities, and they are able to get those services. So our RTV officers collaborate with these government health centers and the extension workers to provide health services in the last community, in the last mile communities. The health services provided are many, but I'll just mention just a few for the purpose of this platform.
Yeah.
One of them is the provision of health talk. We are talking about blood testing, we are talking about diagnosis, we are talking about medical dispensing, we are talking about HCT, to do with HIV, we are talking about family planning and nutrition boosting. All these services are very key because the communities actually don't have access to this. So when we offer that, then we are able to get communities, get some of the services, which takes away some of the challenges that we find, there. Another intervention that we know has been very instrumental is access to clean water. You know that only a small percentage, around 35% of Ugandans have access to basic water supply. Now here we are just talking about basic water supply. Now the percentage even becomes lower when it comes to clean water. The government of Uganda now aims to have clean water for everyone by 2030. But is that going to be achieved immediately?
Yeah.
Maybe not. So one of the things we are doing to achieve this goal as Raising the Village is how do we ensure there is investment in quality water infrastructure, which involves restoring and maintaining clean water sources. So much of Uganda's water sources are open water and swampland. So last mile communities, because of being very far, then they don't always have the opportunity to get support, especially from government and other NGOs. So RTV is focused on that intervention of providing clean water to these communities. And we are doing that in order to reduce waterborne diseases. We know that if people keep taking, unsafe water, then we see so much, there are more diseases coming to these communities. So RTV is doing this, and we are doing this through construction of shallow wells. We are protecting springs. We are providing them water tanks. We are even doing extensions, especially from communities like, for example, towns have water. So RTV is able to extend water from the towns and take them to the last mile communities. We've done this in quite a number of places. Yeah, so for us, providing clean water is very instrumental, and there is a way to connect to supporting the health interventions that we are doing.
Speaking of bigger impact and reaching more communities, can you talk about RTV health outreaches and how you're planning to move forward? I know it's been a big project, so I want you to highlight it more and talk to the listeners more about it. Those who don't know about the health outreaches, and maybe you can explain what you exactly do.
Yeah, sure. Talking about health outreaches, also talking about these times of COVID-19, and also talking about last mile communities. Health outreaches, where you are bringing services closer to the communities, becomes such a very essential activity. And this does two purposes. One is that we are also helping health workers to reach more people, because RTV is working. We have a collaboration with government. So we are helping health workers because they are very far away from the health centers, are far away from the last mile communities. So we are taking the services closer to the people. So yeah, we are reaching more people. But then number two is that we are also now taking services to the people. So people were not able to seek services, they are able to actually get these services. And because of the operational efficiency, health outreaches are very high demand by both the community and the local leadership. We've seen that taking these services closer to people makes it even, we get more numbers coming to to seek services. So there is so much demand coming from government. There's so much demand coming from the local leadership. There is so much demand also coming from the communities. So what we are going to do moving forward as RTV, we would like to continue work with government structures to provide these communities with more of these services, but also talking right now and looking at vaccines, especially the COVID vaccines. We also want to make sure that these vaccines now come closer to the communities and they are able to have access them. And we believe that when we are able to offer these vaccines, then we are able to protect our communities even further.
I love what you just said, David. It makes me more proud to be part of a great organization. I'm sure you also feel the same. As we are still fighting COVID, what we need to know and learn to best respond to future challenges and unexpected events when working with last mile communities.
Yeah, during this time, we've actually learned a lot because, when you go through the COVID period, this is the first time we are going through it. So lessons have come our way, and these lessons actually shape how we are going also to do our future interventions. We've also learned how to best work with government, how to have community structures, how to work with local leaders. So we've picked quite a lesson. But I want to just give you a few examples of what I think the key lessons in line with these times. When it comes to government of Uganda, we worked with government to support them with the testing, to do testing and refer them to treatment centers for those who were sick. That is something. So RTV has really been very instrumental, especially around the COVID, mobilizing community. There are so many myths around the COVID, including even the vaccines. So RTV comes in and offers the right information to these communities because at the end of the day, we want them to take informed decisions. With those communities, we've also linked them up to health facilities that, provided health workers who those communities, we've also linked them up with health facilities that, have health workers who carry out community level sensitization about COVID. Through the pandemic and even through lockdown, like I mentioned earlier, is that RTV was fully operational. That was made possible because we had protocols to safeguard our staff members, but also the communities while providing services. For us, we believe as RTV that we need to first safeguard and keep our staff members safe. But also, by doing so, we are actually, in a way, supporting also the communities to keep safe. So how do we create protocols? So ensuring that our staff members are leading by example, but also by ensuring we do the SAD operating procedures of every time staff members sanitizing or cleaning their hands, wearing a face mask, all these kind of protocols. And then we also expect that for the communities, and we've seen communities complying and being able to do that, and that has helped us, especially for last mile communities, to safeguard themselves against the COVID-19. You are going to see that for the cases are not as bad. You've had so many cases, especially in cities, in towns. In our last mile communities, the cases are really very low because of what RTV has been doing. However, as we're doing that, of course, we faced a few challenges, along the way. And one of the challenges that we've seen is to do with the access to vaccines for the community members. Since most centers have always had, vaccine shortages and delays, that happened at the very beginning, but of late, that has completely changed because the government has really brought in so much.
Yeah.
There are so vaccines coming through. And what RTV has done is that how do we ensure that we take away the myth, people who think that the vaccines are not safe? We give them the right information and educate them why they should access these vaccines. And we've seen most of them actually accessing, and the compliance rate is very, 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 very good.
Is there anything else you want to share with our audience and funders before we end?
Yeah, I want to share just two more things. The first one is a very interesting innovation, which would be agriculture related, but it has a very direct connection to health. One of the immediate interventions that RTV did, which I think has turned out to be such a very important intervention, even for government, is making sure that we introduce what we call the ready-to-eat garden boxes. So we are talking about vegetables that we're giving to these last mile communities, to households. So our household were receiving these seed kits with crops that are harvested and ready in 3 to 4 weeks and serve as a reliable and sustainable food source. And we saw over 1 million beneficiaries from this.
Wow.
And this is one of our urgent responses to the most urgent needs of these families as we're going through this COVID-19. So we saw that actually communities embrace this, and we are seeing now even communities starting, to even grow more of this, because we want our people to have nutritious meals. When we are going through COVID-19, nutrition becomes key. That are people able to have a nutritious meal that boosts their immunity, and in case there are issues, they get the virus, then it doesn't affect them. We've seen this happen. We are now working very strongly. We have a very strong relationship with government structure, and we are actually committed to ensuring that these kind of partnerships to create sustainable solutions in last mile communities, continue. So we are grateful that we're able to really come up with a very quick intervention which the community has embraced, and it has moved wide and far.
Yeah,
As I end my conversation with you, I would like to say that as RTV, we are committed to creating sustainable solutions to last mile communities. For us to do this, we need resources. We need support from everyone. So my humble appeal is whoever is listening to us, with your donations to RTV, we are able to support community and frontline health workers to transform health outcomes and save lives in last mile communities. We count on you. Thank you.
I second that. Thank you so much, David. I really appreciate your time, and I hope everyone is going to enjoy your wonderful knowledge and tips. And thank you everyone for tuning in. I'll see you in another episode. Thank you everyone for listening. If you want to find out more about the work we do, we encourage you to visit our website and follow us on our social media channels. Our website and socials are linked in the description box below. Thanks again for listening, and we hope you will join us again next time in RTV Chit-Chat.